Hi, welcome to Beyond Extraordinary, brought to you by LCMC Health. On August 29, 2005, Hurricane Katrina made landfall as a powerful Category 4 storm, causing widespread devastation and damage across the New Orleans area and Mississippi Gulf Coast. One of the deadliest and most destructive storms in U.S. history, the storm's powerful winds and a massive storm surge overwhelmed our levee system, flooding approximately 80% of the city. Due to lasting damage, some area hospitals never reopened, leading to a gap in healthcare services that desperately needed to be filled. A few years later, in 2009, LCMC Health formed as a new healthcare system out of two existing facilities, Turo and Children's Hospital New Orleans. Now we have grown into an 8-hospital system providing health, care, and education to the greater New Orleans area. This month, we celebrate the 10th anniversary of University Medical Center New Orleans, which has become a staple of medical and academic excellence in our community. My name is Charlotte Parent. I'm the VP of Business Development for University Medical Center New Orleans. Here with me to tell the story is Dr. Peter W., an emergency medicine and pulmonary care medicine at University Medical Center. Hi, Peter.
Hey, Charlotte.
You know why we're here today and what we're here to talk about. I'm going to start off with some questions for you. And the first one is, you've been practicing in New Orleans for over 37 years. You and I are probably about what and what with that. What are some of the changes that you've seen or you've noticed post-Katrina?
So the changes post-Katrina are an enormous degree when you consider healthcare and how it's delivered. We went from convention centers, parking lots, all the way to a $1.1 billion facility that people across the world would be envious of.
The building, if our community has not seen it, they should come and take a look and see how we built better post-Katrina. You know, we were lucky. Part of what happened, out of that disaster came an opportunity for resilience and to really build something that is something that the community could be proud of. Can we talk a little bit about the structure of healthcare and how have you seen it change since post-Katrina, and what have we done to improve what that looks like?
Sure. I would go back pre-Katrina and just say that healthcare delivery was fractured within our region. There was a charity hospital system, and then there were multiple private hospitals, and then there was an auctioneer system as well. But it was fragmented care. It wasn't consolidated care for our patients. Then Katrina came, and it devastated all of those systems. Whether you were an individual hospital, whether you were the charity system, or whether you were the auctioneer system, all of them were dealt a pretty tremendous blow. And then our patients, our community, suffered as a result of that.
And was spread out across the state of Louisiana, even to get back. I remember during that time that not only was the healthcare fragmented, but prior to Katrina, extremely siloed. And the good news that happened after Katrina took a little time, but was that the walls came down. People began to work together. So can we talk a little bit about some of those relationships and maybe even talk about the relationship with our academic schools and what the system now looks like?
Certainly. So the charity hospital system, and in particular Charity Hospital in New Orleans, was always the primary training site for both LSU and Tulane medical schools. As a result, somewhere between 60 to 70% of the practicing physicians within our state actually trained within the walls of Charity Hospital, which is a pretty astounding number when you think about it. And then we talk about post-Katrina, that really hasn't changed, that both of those medical schools heavily rely on University Medical Center, which is somewhat the replacement hospital for Charity Hospital in regards to a community asset, and not just a local community asset, but also a state and regional community asset.
Yeah, I think one of the things that you and I have both seen is the relationships between not only the academic institutions that are here, the other institutes that work out of our hospital to train, We are the largest place for training for many different disciplines at University Medical Center, and that continues. And I think the last thing is our community connections. We have built strong connections with various entities in the city to make it work.
Absolutely.
Yeah.
Absolutely. And we're cognizant that 2 blocks away from University Medical Center, those folks who live simply 2 blocks away, suffer from the lowest the lowest survival rates and highest mortality of anybody else in the city. So it's not just the access in geography, it's the access of being welcomed, and then having programs that fit those needs.
So, Dr. W., can you tell us a little bit more about how University Medical Center came to be post-Katrina?
That's a long story, but I'll try and condense it for our listeners. So we needed a replacement hospital for Charity Hospital that provided a platform for both medical schools to teach from, but more importantly, to provide for our community the much needed care. And so there was consolidated efforts from both medical schools, lawmakers, and the community to put pressure locally, state, and then nationally on a replacement hospital. And so those same individuals were called to the table to plan to say, what would that next iteration of a charity hospital or a safety net facility look like? And so that planning took about 5 years, and then took about 5 years to break ground and then to create a $1.1 billion facility. So a true gem, an amazing resource for our region.
So tell me a little bit about some of the special things in terms of care that we do at university that maybe you don't see anywhere else.
We all live, I think, in La La Land. And by that, I mean that we come and go, we drive to work, we drive our families around and don't understand that we're one car accident away, one work accident away from needing a level 1 trauma center. And the beauty behind a level 1 trauma center, it is a regional resource. What does that really mean? It means that 24/7, 365, we have surgeons, emergency medicine physicians, anesthesiologists, and specialists on call to address your trauma. Now, what does that really mean? What does that boil down to? Well, within 5 minutes, we can get you to a waiting operating room. And so there's a lot that can happen when there's delays in that. And when you don't have those folks at the bedside to take care of the next patient, those delays could stretch from 5 minutes to an hour to 2 hours, delaying your entry into an operating room that could provide life-saving services. There's a lot of blood loss, a lot of poor outcomes that can happen as a result. And so we have a well-oiled machine, and it's really a concert of experts, both from the nursing standpoint, respiratory standpoint, surgical subspecialty standpoint, emergency medicine, and anesthesia, all working, as a fine-tuned machine in concert with each other to deliver the best care for children, for pregnant patients, for adults, for everybody in our community.
Yeah. And compound on top of that, the addition of the burn center, which is just a complement to add to the trauma center. And I think for us, we got to see it in full operation. I mean, we do this every day. We do it every day, but we got to see it in full operation with the mass casualty incident,
Right.
and how that works like a fine-tuned machine to serve the people that we needed to serve and get them the care that they needed.
Absolutely. The New Year's Eve mass casualty incident is one of many that we've had over the last 5 years, because this is what we do. This is what we see. Those others, whether it's a car pile up on the twin spans or multiple shootings, those come to us as well. And that helps keep us well trained.
Yeah.
And this is why we're a regional resource.
Yeah. Again, post-Katrina, what became very glaring at the time was the need to meet people and their social determinants where they are. If you were here for Katrina and you saw how we had to move people and what we had to do, what people didn't have, the role of university in that, and the role of LCMC, frankly, in this across the city, is great. And we stepped up. I really do believe we've stepped up.
There's no question, but I think it's a combination of factors that helped us do that. And part of it is LCMC and their group of hospitals and services, whether you're talking about pediatrics at Children's or whether you're talking about maternal at Toro or whether you're talking about community-based at New Orleans East or going across the Mississippi River between West Jefferson and East Jefferson hospitals, which have long-standing history of community service, but it's also combining that with a medical record, Epic, that has transformed how we deliver healthcare. So if you were in the emergency department at Toro Hospital, I can easily review your record, just as easily as if you were at East Jefferson or at an Ochsner facility or at New Orleans East. And so this fragmented care was suddenly consolidated.
Something we didn't have before
No.
Katrina.
No.
Something we didn't have before Katrina that has led to better health care.
Outstanding healthcare and improved healthcare and, reduction, duplication of services and, meeting, again, patients where they are.
Yeah. How do you feel about the future of healthcare in New Orleans and more specifically, UMC's role in it?
So I think UMC has a primary role, as we mentioned earlier, not just educating physicians, but educating the next generation of healthcare providers, whether it be nurses, allied health, physical therapists, occupational therapists, psychologists, and the like. So that's a huge mission and responsibility, but one we're well positioned for. When we start thinking about programming and filling needs, I think UMC, and for that matter, LCMC, has stepped up and has been really strong leaders in the field of bridging to the community, whether it's New Orleans East Hospital, whether it's the Trauma Recovery Center. Those are just small examples of where we're listening to the community and providing for the community.
Yeah, and stepping in.
Yes.
Stepping in and not stepping on.
Right.
Because our intent is to put things in our community that they're asking for.
Well, not for me without me.
Yeah, exactly. And listening to them and really building on what that looks like, not just at University Medical Center, but at all of the hospitals within the LCMC health system. It starts at University. We are at the center of the city and the core of what goes on, but the intent and the mission is spread throughout the LCMC hospitals. Is there anything else that you want to add about care?
Two things. One thing is a remembrance for all those individuals who helped us get us where we are now. So those people who were there during Katrina and providing health care in all the hospitals across the metropolitan area. Without those individuals, because we stand on their shoulders.
Mhm.
And we stand on the shoulders of those people who helped us move forward in the days right after Katrina and the months and the years after Katrina. And so that's a remembrance and a salute to those individuals because we continue to stand on their shoulders. That's one thing from a remembrance standpoint. The next part is we should be excited about healthcare. And the reason we should be excited about healthcare is you need only look at the burn center. And so we didn't have a burn center for over 30 years at Charity Hospital. And then it was brought back. And it was brought back because it was a regional need, not just a local need, not just a statewide need, but a regional need. And if you look and say, here we have the Gulf South and the Gulf of Mexico with all those oil rigs, and if there's a disaster there, the next closest combination of trauma center and burn center is Galveston or Tampa. So we're ground zero for all of that. And so that should give our listening audience a glimpse into the intentionality and what we need to do to provide not just safety net services locally, but regionally with an eye for that and understanding when you build for those things, you're attracting the best and the brightest, not just to come train, but to stay.
Yeah, absolutely. Um, I think we can close with that University Medical Center LCMC Health System is an absolute uh, example of the resiliency of New Orleans, the state of Louisiana post Katrina. If anyone had said to us 20 years ago that this is where we would be, I don't know for people who were in Katrina at that time if we would have thought this.
There would have been a great amount of
Right,
dispraise.
yeah, because I can remember when I came back and I said, "We're really gonna do this?" And we did. And it's amazing where we are 20 years later. 10 years for University Medical Center after the building. Like I said, if you've not seen our facilities, as a community, you should come and take a look at it. You would be amazed at what has happened
Right.
in this city and what we've built. So thank you, Dr. W, for joining me today. I appreciate it.
Thank you for the privilege.
And thank you for having us on Healthcare Beyond Extraordinary.